In today's episode on the hospitals of the future, we'll try to understand two healthcare payment models: fee for service versus value based care. Navigating the healthcare system can be quite daunting, especially when you hear terms like fee for service, value based care. These payment models are crucial in understanding how healthcare is delivered and reimbursed or paid for. Today, we'll dive into these two approaches to better understand what they mean and how they affect both patients and providers. First, fee for service. The classic model, fee for service, is the traditional model of healthcare payment. As the name suggests, under this model, healthcare providers such as doctors, hospitals are paid for each service they perform. For example, each surgery, each consultation. This could be a simple checkup or something more complex like a surgical procedure. Think of it like a restaurant menu where each service is itemized and has a price attached to it. Historically, this has been the dominant model in the United States healthcare system. It made sense in an era focused on treating acute conditions. You get sick, you go to the doctor, you get treated, and they get paid for that treatment. From a provider's perspective, it is straightforward to track and bill for specific services. However, the simplicity of fee for service has its downsides. Critics argue that it can encourage overutilization, where more tests or procedures are ordered even when they may not be necessary. This more is better approach can drive up healthcare costs without improving patient outcomes. While overutilization is a concern, it's important to note that fee for service isn't inherently bad. It allows patients to receive the care they need without worrying about the cost of every test or procedure, especially for those with significant healthcare needs. In this way, it offers some peace of mind. I'll come to the second payment model, which is called value based care. The new approach, in contrast to fee for service, value based care shifts the focus from treating illness to keeping people healthy. Value means cost, the quality divided by the cost. The aim is prevention, keeping people out of hospital in the first place. Instead of paying providers for each service, they are compensated based on the value or quality of care they provide. But what does value mean in healthcare? This is where it gets tricky. Value in healthcare can be measured by factors like how well chronic conditions are managed, like diabetes, hypertension, hospital readmission rates, and even patient satisfaction. Essentially, it's about looking at the bigger picture of patients' health and well being. The potential benefits of value based care are significant. It aligns the interest of both patients and providers by incentivizing preventive care and improved health outcomes. For example, if providers are rewarded for keeping their patients healthy, everyone benefits. Patients avoid hospital stays, and healthcare costs are also controlled. The pros and cons of each model, free for service, the pros are: one is physician autonomy. Under the fee for service model, physicians have the freedom to make decisions without being constrained by strict guidelines. This allows for more personalized care tailored to individual patient needs. Simple billing structure. It's easy. Providers are compensated for each service, making it very straightforward to bill for the work which is performed. Now, what are the cons of fee for service? Overutilization. Providers might be naturally incentivized to order unnecessary tests or procedures, driving up costs without improving health outcomes. Number two, higher healthcare costs. The itemized nature of this model contributes to the overall high cost of healthcare. This is evident in the United States. Now we look at the pros of what the value-based care. It is focused on outcomes. Value-based care encourages providers to focus on the overall health of the patient rather than just treating individual illnesses. This can lead to better long-term health outcomes for sure. Number two, cost control. By incentivizing preventive care, value-based care has the potential to reduce overall healthcare spending. Now let us look at the cons of what are the drawbacks of value-based care. First is the financial risk for providers. Under value-based care, providers take on some financial responsibility for the patient's health. If the patients don't meet certain health metrics, like outcomes, providers might see reduced reimbursement rates. Number two, equity concerns. Providers who are serving underprivileged communities may face additional challenges as their patients might have more complex healthcare needs, making it harder to meet certain metrics. Now, why this discussion on or why this shift towards value-based care? Why are we seeing this shift towards value-based care? The move is driven by payers, insurance companies, and government programs that are increasingly pushing for a value-driven approach. It is not just about cutting costs. It is about recognizing the importance of patient satisfaction. Value means the quality divided by cost, preventive care, and addressing the social determinants of health. For example, in India, the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana played a significant role in laying the groundwork for this shift, encouraging new payment models that reward higher quality care. But even though value-based care has gained momentum, there are still challenges to its widespread adoption. One of the biggest challenges is figuring out how to measure quality in a standardized, meaningful way. You can't just quantify everything in healthcare, and the complexity of tracking outcomes across different care settings add another layer of difficulty. Moreover, we need the right technology to support value-based care, such as robust health information systems, HIS, that allow for seamless data sharing between providers. What happens to the doctor-patient relationship and healthcare digital revolution? As we shift from fee-for-service to value-based care, there is another important question. What does this mean for doctor-patient relationship? As the reimbursement model changes, will doctors feel pressurized to meet metrics rather than focusing on individual needs of their patients? These are questions we must consider carefully as healthcare continues to evolve. On top of that, we are also facing a digital revolution in healthcare. With value-based care relying on data to track outcomes and improve health, technology plays a crucial role. The ability to share patient data between providers and ensure continuity of care is essential for this model to succeed. But as with any major shift, comes with challenges. It comes with challenges, particularly around equitable access to care and ensuring that no one is left behind. So here comes the significance of the newer concept called payviders. Traditionally, there is a payer, that is either the insurance or the government or someone who is paying for the treatment. And second is the provider, which is either the doctor, the hospital, or a facility. And the third is the patient. The interesting thing is, all the three components of this, none trust the other. For example, the patient doesn't trust the insurance doesn't trust the hospital doesn't trust the insurance. So what is the alternative? So just imagine with the new concept which is called payvider, where the payer as well as the provider becomes the same. We will delve into the payvider concept in the next episode. So see you next time with the third episode of Hospitals of the Future, where we delve deep into the newer concept of payviders. Thank you for your listening, and please do share your thoughts, comments, and feedback. See you next time. Thank you.